Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Enuresis. Enuresis is near complete evacuation of bladder at wrong place and wrong time, at least twice a month after 5 years of age. 75% enuresis is nocturnal and this is due to behavioral problem, and 25% enuresis. In 25% enuresis there can be evacuation of bladder at day or night. So this 25% enuresis, which can occur either in day or night, is mostly due to urinary tract infections. Boys are more commonly affected than girls. Treatment. In treatment, we can give motivational therapy or alarm therapy. Alarm therapy is the conditional therapy. The most successful treatment option for this therapy is alarm therapy, which is used after 7 years of age. Medications are oral desmopressin can be used for nocturnal enuresis. Oral desmopressin is used in the dosage of 0.2 to 0.6 milligrams after 7 years of age. Medications of oral the desmopressin can also be used as nasal in the nasal route, but nasal desmopressin is not used nowadays. The side effects of desmopressin are there can be seizures or hyponatremia in the child. Anticholinergics like oxybutynin, tolteridone can also be given, or imipramine can also be given, which is a tricyclic antidepressant.
so drugs like oxybutynin, tolteridone, imipramine can be given. Nasal desmopressin can be given, but it is not given because of seizures and hyponatremia. Oral desmopressin is given in the dosage of 0.2 to 0.6 milligrams after the age of 7 years. Thank you and thank you for watching.